Have you ever noticed this? You're dealing with chronic bloating, gut pain, maybe even bladder irritation, and then you fast for a day or two and poof, it all just vanishes. It's a really common experience, but it can feel kind of mysterious. Well, in this explainer, we're going to pull back the curtain and look at the science behind why this happens.
So what is actually going on here? Why do these super persistent, frustrating symptoms just go quiet all of a sudden when you're fasting? Let's get right into what's happening inside your body the moment you stop eating.
You know, a lot of people think the gut somehow magically and completely heals itself in just a couple of days. But the reality is a little more straightforward. The relief you feel isn't because of some miraculous overnight repair. It's because you've simply taken away all the inflammatory triggers at the same time.
Really, the best way to picture this is to think about fasting like hitting a giant, system-wide pause button. It's not a permanent fix, of course, but it gives a bunch of key systems a much-needed break from their daily grind, and, more importantly, from all the things that are constantly stressing them out.
Okay, so what exactly gets put on pause when you press that button? Let's break down the main systems that get to take a breather, because understanding them is the key to understanding that profound relief so many people feel.
So first up is the enteric nervous system, or ENS. You've probably heard it called the second brain in your gut, and for good reason. Now, in conditions like IBS, this whole network of nerves can become hypersensitive. It's basically on high alert 24/7, which means even normal digestive processes can feel really painful.
But when you're fasting, it's pretty simple, right? There's no food coming in, so there's no stretching of the gut wall. That immediately calms things down. But it also creates this amazing ripple effect. Immune signals quiet down, neurotransmitters in the gut start to stabilize, and the direct result is that your second brain finally gets to chill out, and those pain and pressure signals just fade away.
And this is exactly why so many people use these specific words to describe what it feels like. That feeling of your gut becoming quiet or peaceful, that's not just in your head. It's the real physical sensation of your nervous system getting a well-deserved break.
All right, next system on pause is your gut's own immune system. It's called GULT, for gut-associated lymphoid tissue. And you can think of it as this huge active security team that's embedded all along your intestinal lining. Its job is to constantly monitor every single thing that comes through.
Well, fasting basically gives this entire security force a vacation. With no new food particles to check out, those super reactive mast cells, the ones that release things like histamine, they just become way less active. This causes a massive drop in gut inflammation and dials down major inflammatory pathways.
And the third key player here is something called the migrating motor complex, or MMC. Just think of it as your gut's built-in overnight cleaning crew. It's this powerful wave that sweeps through your small intestine. But here's the catch. It only really gets to do its job when you're not eating.
So, during the longer fast, this MMC cleaning wave just gets to run on a loop, completely uninterrupted. It's sweeping out all those leftover food bits and excess bacteria, which is huge for preventing that overgrowth in the small intestine, a major cause of fermentation, and that horrible bloating pressure.
And that leads us to the most direct link of all. A lot of that painful bloating and gas comes from gut bacteria fermenting the food you eat. So when you take away the food, you take away their fuel. It's really that simple. The fermentation factory shuts down, and the gas and pressure, they just stop.
Okay, so we've got a good handle on the gut, but this is where the story gets even more fascinating. Why on earth do bladder symptoms, like that constant urgency or pelvic pain, why do they often get better at the exact same time? Well, the answer is this incredible connection called the gut-bladder axis.
And this is the million-dollar question, right? It connects these two things that seem totally separate. But the truth is, these organs are not isolated at all. They are deeply connected and are basically talking to each other all the time.
Their connection really works in three main ways. First, they share nerve pathways. So an irritation signal from the gut can literally crosstalk and make the bladder feel irritated too. Second, both organs have tons of those inflammatory mast cells we talked about. And finally, those chemical alarm signals like histamine can get into the bloodstream and directly trigger the bladder.
This whole thing has a name. It's called cross-organ sensitization. It's a key idea. It just means that when your gut is shouting because it's inflamed, it can make the nerves in your bladder next door way more sensitive and jumpy. So by calming the gut, you're indirectly telling the bladder it can calm down too. So we know that feeling of relief you get during a fast is absolutely real, and it's all based on these powerful systems hitting the pause button. But here's the most important takeaway from this entire explainer. The fast itself isn't actually the main event.
When does the really crucial moment of insight happen? It's not when you're in the middle of the fast, feeling great. Nope, the real detective work starts after it's all over.
The most valuable information you'll ever get from this experience comes after the fast ends. Reintroducing food, that's the real test. I mean, think about it. The fast gives you this beautiful, clean slate, a totally quiet system. And now you get to see what happens when you start adding things back in one by one.
This is your chance to become a detective for your own body. As you start eating again, you have to pay super close attention. Do your symptoms come roaring back almost immediately? Does that old familiar bloating show up again? Can you start to pinpoint one specific food, or maybe a whole food group that sets things off?
This process of just carefully observing what happens is so incredibly powerful because how your symptoms come back and when they come back gives you vital clues about what's really driving your issues. The fast clears away all the noise, the refeeding helps you find the actual signal. And those signals can point you toward a few really common culprits. Is the main problem a bacterial imbalance, something called dysbiosis? Or is it more about histamine and mast cell activation? It could even be a more classic immune response to a certain food. The pattern of how you feel when you refeed can really help you figure out the root cause.
So the big takeaway here is this. Fasting is so much more than just a temporary break. It's a powerful diagnostic tool. It gives you this rare opportunity to listen to what your body is saying in a quiet environment. So the next time this happens to you, don't just enjoy the peace. Ask yourself, what is my body trying to tell me now that the pause is over?